So our agenda here today, we'll do some introductions. We'll dive into the feature presentation. First, we'll just set the context or set the table with an overview of the vagus nerve and HRV. Dr. Navas is going to cover the 4 types of stress and how to identify them. Then we're going to talk about how do you actually start to identify vagus nerve dysfunction if you're working with individual clients or patients. We have a lot of new ways to do this now that simply didn't exist before. We can start to get biofeedback from individuals every single day that give us strong indications of vagus nerve dysfunction. And then Sachin and Dr. Navas will talk about treatment protocols. That could be a whole webinar in itself, but we'll cover some of the most common interventions and we can go from there. We have some great prizes we'll give away at the end. And then for those of you who want to get more information on how to implement what we're talking about in practice, we'll have some information on next steps. So starting off with our feature educator is Dr. Navas. He is the author of 2 books on the vagus nerve. One is called Activate Your Vagus Nerve. The other is Upgrade Your Vagus Nerve. Dr. Navas is a doctor in chiropractic medicine. He's also expanded into full-blown functional medicine practice. He is the founder of Health Upgraded, which is an online education platform around the vagus nerve. And he is the host of the Health Upgrade podcast. Dr. Navas, welcome and thank you.
Thank you so much for everything, David. This has been great so far. I'm excited to do this.
And Dr. Navas's email address is here on the slide. We can also post it in the chat. If anybody wants to follow up with Dr. Navas after the webinar, feel free to do so. And our second subject matter is Mr. Sachin Patel. He is the founder of the Living Proof Institute and the Perfect Practice. He's a breathwork facilitator. And Sachin's also one of the first individuals I spoke with many, many years ago who had figured out how to use heart rate variability as this universal biomarker that gives him an indicator of how well each person is doing, just almost like a resilience score. Sachin, you may remember on the podcast several years ago, just due to some of the limitations of working in Canada as a chiropractor, it restricted your ability to run a lot of the diagnostics. So you'd figured out a way to basically use heart rate variability as kind of your primary indicator of how well an individual is doing relative to baseline and started to build programs around that. So you also were one of the first guys I spoke to who had really figured out how to operationalize the Oura ring in a clinical practice, which was actually hard to do back in the day because you had to get sizing kits and get those shipped out and get rings and place orders and get it connected. So you were the first one who actually cracked the code on both of those things. So welcome, Sachin, and thank you for sharing your expertise here today, sir.
It's my honor, David. Thank you. And this is a full circle moment with Navas being here, with you being here. You know, Heads Up has made a huge difference in our practice, how we deliver care, how we monitor care. And I'm really honored and excited to be part of this conversation. So thank you. And thank you for everyone for taking time out of your schedules to be here. You could have been anywhere. However, the fact that you're here tells me that A, this is important to you, and B, that we are committed to sharing life-changing information that you can put into application right away. So it's an honor. Thank you.
Thanks, Sachin. And I'm Dave Korsunsky. I'm the founder and CEO at Heads Up, which basically means I take out the trash and I pay the bills. But we're also building a world-class technology platform. Really, one of the areas that Heads Up can be very powerful is actually starting to monitor heart rate variability on all of your clients or patients in the wild, and be able to bring that data into one centralized platform and analyze it and use it to make decisions. So we'll talk about how we can empower clinicians to implement monitoring of heart rate variability in practice with real biometric data collected accurately and precisely from people every single day in real time. In the chat, for those who have questions on anything that we're covering today, we have Don Moxley. He's one of our subject matter experts on heart rate variability. We have Chuck Hazard. He's one of our experts on all things wearables, HRV, and performance and biohacking. And then we have Erin Knight, who's our head of sales and can answer any questions about Heads Up, getting started, implementing in practice. And she's also an extremely knowledgeable and talented biohacker herself. So feel free to fire away in the chat with questions. It's usually one of the more exciting parts of the webinar. We get a really, really active dialogue going in the chat. So feel free to ping the experts there. Also, if you are able to ask a question of our subject matter experts that they can't answer, that is one of the best ways to qualify for one of our partner sponsored prizes. So we have three vagus nerve stimulator devices from Truvaga that we'll be giving away at the end of the webinar. We also have one of our sponsors is liposomal curcumin from a company called Kurt. We will be giving away an Oura ring, which is our preferred device for monitoring HRV and other biomarkers related to resilience and recovery. And then Dr. Navas will be giving away 3 signed copies of his latest book. I have my copy here, Dr. Navas. I didn't get an autographed copy. I got mine on Amazon. But for those who are attending today, they'll get the autographed copies.
I will sign it for you next time I see you, David.
I'll take you up on that. Good reason for me to come to Toronto and visit you guys. All right. So Sachin and Navas, we're going to turn it over to you. Well, Dr. Navas, I believe this is your section here where you're basically going to set the table for us on the rest of the presentation. So just give me a verbal cue, Dr. Navas, when you want me to advance the slide, and we'll go from there. Over to you, sir.
Sounds great. Thank you all for being here. I'm really excited to dig into this. It is very much a full circle moment as well. Sachin was my introduction to functional medicine. There's a whole story about this. You can listen to either the podcast that I did with him on my podcast or the one that I recently did on his podcast to learn more about that story, if you're ever interested in hearing a fun, amazing story. It was that introduction and the work that I learned working part of the Living Proof Institute with Sachin, where I really started learning about the importance of the vagus nerve and just how powerful this tool is. So let's dig into where the vagus nerve is right off the bat. From an anatomical standpoint, the vagus nerve is located within the carotid sheath. So this is a kind of cross section of the neck that we see on the left side here. And we have obviously the muscles that are sitting in front. We've got the sternocleidomastoid muscle, which is the one that goes from the mastoid of the bone, of the head down here on the back end, just kind of behind your ear, down towards the center of your collarbone, sternocleidomastoid. And right behind that is where we'll find the carotid sheath, which has 3 different structures inside it: the carotid artery, the jugular vein, and the vagus nerve. 3 very important structures that are located together. For me, this was the first clue as to just how important this nerve is, because we've got this tissue that's supporting and ensuring the functionality and the safety of the blood vessel that's bringing blood flow to the brain, the blood vessel that's bringing blood flow from the brain back down to the body, and the vagus nerve. And so this was probably a sign to me saying the vagus nerve is unique in this very important manner. And so if we ever want to find it, just so everybody who wants to find it on themselves, if you push your head into your hand, you can actually pop that muscle up, the sternocleidomastoid muscle, and you'll just go and find. And if you find your pulse, you're actually within a couple of millimeters of your vagus nerve. You'll see on the right side here, the image on the right, the vagus nerve is outlined literally being beside the common carotid artery between the sternocleidomastoid and your scalene muscles here. So I really think this is just an important factor to understand, and a great way to understand that this is the most easily accessible spot where the vagus nerve can be found. So we'll move on to the
your
next
comment
slide
here,
where,
Navas,
yes,
it's
please.
not in Las Vegas then.
It is not in
what
Las
you're saying.
Vegas. It's actually the best
Okay.
place to activate your vagus nerve is not Las Vegas.
That's a clinical pearl right there from Dr. Navas, by the way.
So if we talk about the vagus nerve signals, just to understand how these signals are passed and just how much of it is actually going from the brain to the body versus the body to the brain. And I think we've done a terrible job of separating the body into all of these different systems, all of these different organs, when in reality, humans function in a holistic manner. Everything needs to work together. And so this is going to bring a lot of that information to understand why the vagus nerve is so important, because its job is to connect a lot of these important systems. The first important area to understand is that 80% of the signals on the vagus nerve are coming up from the visceral organs up to the brain. This is really, really important to understand that 80%, 4/5 of the information that's being passed on this nerve is not brain to body, it's body to brain. We need to know what's happening in the stomach, in the heart, in the kidneys, in the lungs. We need to know what's going on with the microbiome and that gut brain axis, literally having the microbiome signals that take place, the short chain fatty acid presentations, how leaky the gut is, how much inflammation is there. That information needs to be relayed up to the brain. I like to think of the brain as kind of being the CEO of the body, but the CEO needs to get good information. If bad information or if information is not being passed up to the brain effectively, we're not going to be able to make good decisions and thus relay positive or necessary information back down that are instructional markers for what to do. So 80% of that information is coming up. 15% of the information on the vagus nerve is parasympathetic efferent. I'm pretty sure everybody here, for the most part, is a practitioner, so you understand we've got the autonomic nervous system that's split to the sympathetic and the parasympathetic, and the vagus nerve runs that parasympathetic trunk, the primary uh, source of that information. So this is where that rest, digest, recover information is actually sent down from the brain to the organs, and that again makes up only 15% of the information on the vagus nerve. For the math people, you'll notice 5% is missing, so 4% is actually motor, and that's important because it goes down to the muscles of the airway, throat, and vocal cords. So it goes down to the pharyngeal and laryngeal muscles. So this is important for maintaining a good, strong, open, patent airway. It's important for creating vocalization and allowing our voice to have pitch and tone within it. So the reason I can go really, really low or really, really high with my voice goes down to vagus nerve signals, the motor specific signals, going to the laryngeal muscles and tensioning and lengthening or loosening the vocal cords accordingly so that I can have pitch and tone taking place. So clinical pearl here, when you're speaking with your patients, with your clients, don't just listen to what they're saying, but listen to how they're saying it. If they have a very monotonous voice or they're having difficulty breathing while they're going through what they're talking about, these are clinical pearls that you'll be able to identify as motor relay signals that are not working effectively. So it can be a great way to understand that vagus nerve signals may be dysregulated. The last little area, that 1% of sensory information, that's actually from the skin of the ear. So very, very few fibers. In fact, the research is showing just under 1,000 neuronal fibers of the vagus nerve are coming from the skin of the ear, specifically the auricle and the what's called the tragus, that's it. The tragus of the ear and the slight little bit of skin in the center area of the auricle of the ear. So it's a very small area, but for anybody who practices auricular acupuncture, you'll notice points like Shenmen. That point is very much a vaguely activating point. Vagus nerve activation really does take place when you hit that point effectively. So important things to note there. All right. Now, the most important pathway or relay of information through the vagus nerve controls this particular system, which is called the cholinergic anti-inflammatory pathway. The vagus nerve gets its signals from what's happening in all of the organs below, gets those signals going up to the brain, specifically to the brainstem, where we have relay points at the nucleus tractus solitarius, the NTS, and the dorsal vagal motor nucleus, both in the brainstem. So it comes up to the NTS, that's the 80%, and then the 15% parasympathetic efferent information comes down through that dorsal vagal motor nucleus. You'll also notice that information that comes into the NTS does relay up to the hypothalamus and the thalamus to tell the body what to do from an HPA or HPT axis standpoint. And that is actually, we often label the HPA axis as beginning with the hypothalamus, but the hypothalamus requires good information to come into it to be able to relay whether we want cortisol. And yes, thalamus first, you're absolutely right there. So it comes into the thalamus first, and then it relays down to the hypothalamus to then go and have its hormonal effects throughout the rest of the body. So really important to note that. Then the signals that come down through the dorsal vagal motor nucleus go to either directly to those visceral organs, so direct to the lungs. You'll see a direct path of the vagus nerve there, direct to the gut, the ENS, the enteric nervous system. And then we have a direct link to the celiac superior mesenteric ganglia, or the plexus of ganglia there. And we have acetylcholine being released there. Acetylcholine is the only neurotransmitter utilized by the vagus nerve, only, period. Acetylcholine gets released here, and it actually activates the splenic nerve. The splenic nerve is actually a sympathetic nerve. It's part of the sympathetic chain here that the superior mesenteric ganglia is, and it's actually activating a sympathetic nerve. How this is built, we have yet to fully understand why it was built in this exact manner. I have been asked this question, and I've referred it to the man upstairs. I don't know who created this. The energy of God decided to do that, however you believe in that. And we're still trying to figure this out. But it's a sympathetic nerve that activates norepinephrine release at the spleen. That activates the beta 2 adrenergic receptor specifically on important T cells. And these T cells have an enzyme in them called choline acetyltransferase, CHAT. And that names these fun T cells into what's called CHAT cells. And these CHAT cells then go and relay that acetylcholine information out to the rest of the body and to the rest of the organs and tissues that are out there. Acetylcholine is the signal that goes to immune system cells, and immune system cells are located in every single organ of the body. Particularly, and the most important cell type here is of the innate immune system, the macrophages, the tissue resident macrophages that are located in every single one of our organs. The acetylcholine attaches to a very important receptor here called the alpha 7 nicotinic acetylcholine receptor, and that downregulates the inflammatory activation that takes place in these immune cells. This is the key to why this system is called the anti-inflammatory pathway, the cholinergic anti-inflammatory pathway. All right, so I really love this slide because it just everything's kind of in there. For anybody who's interested, take a screenshot of that particular slide. That's my favorite for sure. But if you're interested in learning more about how we can understand how the vagus nerve is working, we'll go to the next slide where we start to talk about HRV. So what is heart rate variability? Why are we able to measure it? And why does it tell us about what's going on with the vagus nerve versus other nerves? We know that we have direct innervation to the heart that's going to dictate whether we go into increase our heart rate or lower our heart rate. We have the blue nerves here are the sympathetic nerves. These sympathetic nerves attach to the sympathetic ganglia, and their job is to act like the accelerator to the heart and to raise the heart rate. So these postganglionic fibers go in, norepinephrine is released into the heart, and that increases your heart rate. We have the parasympathetic nerve, which is specifically the vagus nerve, the cardiac branches, and that's going to have a parasympathetic effect, and that's going to lower the heart rate. And that uses, again, acetylcholine, and that goes to the heart directly to lower the heart rate. The way heart rate variability works is, are you able to utilize these two systems in alternating and effective fashion together? Okay, so the blue signals, the sympathetic signals, are like the accelerator. The vagus nerve signals are like the brakes. You want to have both working very well. Most people we're obviously born with the accelerator and the brake working well, but over time, the brakes wear down. And that's what we're noticing when HRV levels come down. And we'll talk about how that works. But you want to have a good functioning system where the accelerator can work or the brakes can work, and they can go back and forth easily to support one another. Absolutely. So this is the best way to understand it. And the best way I've found to relay that information to my patients is sympathetic is the accelerator, vagus nerve is the brakes. You got to make sure both are working. Without the brakes, the car is a bit of a danger. Without the accelerator, the car is a hunk of junk. So you want both to be working, and there's nothing wrong with the sympathetics as long as the parasympathetics are working with it. All right.
I think you make a good point there, Dr. Navas, which is learning how to use both effectively. And there are times when we can use stimulus and cues when we actually do need to step on the gas. We're getting ready to focus on an important task. We're getting out of bed. We're getting ready for the day. So there's times where you want to know how to use stimulus effectively. And then there's also times where you want to learn how to effectively gear down. And Sachin, you're one of the experts on this, the way you teach your clients to look at ambient lighting, to look at breath work, and so we're going to cover different techniques. Some work on the gas, some work on the brake, and you can start to teach people how to use these two things so that you're able to effectively leverage both sides of the equation here.
Yeah, exactly right. I really do want to make sure that people understand what HRV is. So I love this slide because it encapsulates two people with exactly the same heart rate. We've got two people here, person orange on the top and person green on the bottom. And person orange, if you notice, what we're measuring is we've got a beats per minute of 92 for both of the people. But you'll notice if we look at the person orange, you'll see that between the RR interval, or that time that's measured, is 744 milliseconds, followed by 427 milliseconds, then 498, then 931. Versus person green, we've got 630, 675, 645, 650. Person orange has a lot more variance in the number of milliseconds between beats of the heart. And then if you average that over a period of time, that gives you the HRV number. So obviously this is an exaggerated number on person orange, but the mean RMSSD, what we're measuring here on the time domain, is 313 milliseconds. That's obviously an exaggeration, but in that short period of time, this person has a very high variability versus person green, who has a mean RMSSD of 31. Their heartbeat is much more metronomic. They're rhythmic. They're almost like a metronome, clicking, clicking, clicking at the exact same time over and over. What we're seeing is a difference between person orange, who is able to push the accelerator and push the brakes. So the brakes are on at 744 a little bit. Then we push the accelerator, push those heartbeats a little bit closer together, 427, 498. Then we push the brakes and 931 milliseconds. You want to be able to have both. When we have a lower variance or a lower variability, 630, 675, 645, 650, this tells us that we're more in sympathetic mode. And if we're averaging or spending a lot more time in a lower HRV state, it means we're spending a lot more time in a sympathetic state. And that sympathetic state relays inflammatory information, and it's like pushing the brakes and having your foot on the brakes without being able to push the accelerator, without being able to push the brakes effectively. So that's the key here. When we measure HRV, we should be looking at your ability to switch between the two, and that's what increases the variability marker. Okay, I hope
Yeah,
that's
I think what's
easy for
important for
people.
me here, Navas, is both people actually have the same heart rate.
Yeah.
And that's oftentimes what you'll see when you're looking at the biometric data is I've even seen people where I actually have a much lower resting heart rate just in terms of cardiovascular fitness or efficiency, but may have a lower HRV, for example. So that was important for me just to understand you can have almost identical heart rate, but the variability can be significantly different.
Yeah, absolutely.
Awesome.
And there will be some correlation going back and forth. Lower heart rate generally will find a higher heart rate variability, but it
Yep.
doesn't always happen all the time. So you want to measure
Makes sense.
HRV to
Yep.
know for sure. So what causes vagus nerve dysfunction? And this is what I've spent the last many years really trying to uncover for a lot of my patients, and that's what the book really focused on, is helping to identify what's going wrong so we can make those changes. A lot of this is stuff I learned working with Sachin. And so we'll get into these four types of stress that we need to look at. Number one is daily stress, relationship challenges, parenting challenges, financial challenges, work or business stressors, poor habits, things that everybody kind of has to figure out or deal with on a
Life.
day-to-day basis. Life, exactly. Number two is going to be biochemical stress. These are the microbiome dysbiosis, pesticides and herbicides, toxic air quality, low nutrient density foods. Big one that I think is missed out on a lot is dehydration. So really important ones to note, and we'll get into the weeds on each of these in a moment. One that I think is overlooked by certain practitioners and very focused on by others is physical stress. Obviously, palpation focused practitioners, the chiros, the physios, the osteos, they tend to be really on that physical stress side of things, where biochemical stress is more of where functional medicine really thrives. So, on the physical stress side of things, lack of movement, poor muscle quality, traumatic injuries, poor breathing mechanics, a big one we'll get into, overuse or repetitive strain, even just like athletic injuries is going to be a big part of this as well. And then the last one is psychological stress. These are people who were a victim of a crime, childhood trauma, anxiety and depression, unexpected loss of loved ones, negative self-talk, things that can happen from a psychological standpoint. And I like to outline these as the things that happen in the past that scuff the lens through which you see the world. And we'll get into each of these areas really, really well. Okay, so
Awesome.
let's start with daily stressors. And I outline it as habits because a lot of the stressors that you might experience are generally habitual issues. Habits are actions that you perform frequently and automatically in response to a cue or environmental trigger. So identifying those cues, those triggers, something that creates a reward experience in you. That can be good habits, but a lot of us have those bad habits as well. So let's find out what's driving these dopaminergic reactions. What's driving us to want to experience those dopamine reactions. Okay. So that's going to be a big area to really focus on. And this is, let's just talk to our patients. Let's figure out what's going on in their lives. There's a few questions we can ask that are on the next slide here. What are your top 1 to 3 daily habits that you want to change? Because everybody is to some extent aware of which habits they are uh, really desiring to change in some way that they know is affecting their life in a negative way. So start with the things they're ready to make changes to. Make sure that they're motivated to make those necessary changes and ask if there's specific triggers or cues that they can identify that promote them to want to change or things that are causing them to go down that particular path. Is there a stressor that's causing you to go to the fridge? Is there a moment that's pushing you to experience more of this stress, like checking your bank balance, for example, and you're just having this major stressor that kind of pops up in your body, or it pushes you to do something that you know you shouldn't do. So let's start to identify what those triggers are. These are just great little clinical pearls for the daily stressors that everybody's kind of dealing with, the life stressors. Number 2, we'll go to psychological stress. And this is really the emotions and understanding what's going on from an emotional standpoint. And I'm sure some of you, many of you have probably heard of the polyvagal theory. This is really where the psychological stress plays a major role. And the whole idea here is the concept of neuroception. It's the constant scanning of our surroundings and environment, assessing for danger or threats to our safety that are taking place subconsciously outside the realm of our awareness.
Wow.
Safety is the key here. And we're constantly scanning our environment, asking ourselves the question of, are we safe or am I safe? Safety is the major, major driver of this polyvagal theory and how things work. And if we go to the next slide, you'll see a very clear chart telling us when we're in more of a vagally activated safety state, which is the green area at the bottom here, the social engagement, connection, safety oriented ventral vagal state. In this state, we tend to be very grounded, settled, calm, compassionate. And this is where we're psychologically able to activate the ventral vagal complex. And I'm not going to get into the depth of the polyvagal theory, talking about the ventral versus the dorsal vagal too much, but the ventral vagal is the myelinated fibers, the more recent activated fibers of our bodies that through evolution we've developed this area, which keeps us calm, keeps us in a state where we're in rest, digest, recover state. A big thing to note here is our bodies cannot heal if we are outside of this green state. Healing can only happen when we're in this ventrally vagal state. Now, we will activate. There's no question. There's going to be moments where our body goes into a sympathetic state. Sympathetic is fight or flight activation generally. I also like to think of it as engagement because we are more engaged with people in more of a mildly sympathetic state, right? When we're kind of closer to the orange, but in that yellow state ever so slightly, that keeps us in a state of engagement. So this is, exercise. This is movement. This is being around people. This is engaging in goal-oriented functions, but it will notice increases in blood pressure or heart rate, increases in adrenaline and oxygen circulation. It's going to have a physiological response, so be aware of that. The issue occurs when we go overboard here and we head into that red state which is known as the shutdown or freeze state. And that is the dorsal vagal complex. This is the unmyelinated vagal fibers, and this is where people go into that freeze state. I like to think of it as the deer in the headlights, right? Their body literally goes into a shutdown mode. They're stressed. They know something is coming, but they're not sure what to do about it. And we do tend to find people in this state, but often they're in pretty challenging and life-threatening almost circumstances. So be aware of that. But for the most part, you'll tend to find people are stuck more in that sympathetic yellow state, less so in that red state, unless you're a psychology practitioner where you're working with severe depression, anxiety, suicidal ideation, stuff like that. So be aware of that. The key here is we're constantly scanning our environment to check, are we safe? And we have to learn to be uncomfortable, which is that yellow space, but we want to learn that we are safe even when we're uncomfortable. And being able to kind of go between the yellow and the green state easily is where optimal ideal function does tend to take place. If we go to the next slide, you'll quickly see that we're always surveying that outside environment. And if we sense that we're safe, then we're going to move through our sensations into that state of safety where we go into that green relaxed function state. Versus if we sense danger, we're generally going to push towards that red danger threat response. And this is why emotions tend to take place because fear trumps logic, right? So if we learn that we're not always under fearful circumstances, we can be more logical. We can tend to spend more time using our cognitive processes to advance rather than constantly be in a rumination state, which is where a lot of people tend to be. You'll often hear, oh, nothing's going my way. I'm constantly thinking about all the negatives. It's because these people, unfortunately, are stuck in this danger neuroception response. So that's something to be fully aware of. So a bunch of questions you can ask those patients right off the bat are on the next slide. I'd love to start with this. What was happening in your life prior to or around the time that your symptoms or health struggles began? Have you ever experienced major stressful life events? This is a great thing to just plug into your intake form. Sachin taught me this a long time ago, ensuring that you note that there were potentially some stressful life events and then timelining those out into your understanding of what caused these issues for these patients. Are you particularly sensitive to loud noises? Loud noises are a very easy way to gauge how quickly is somebody pushing into a sympathetic state. Are they really pushing into this activated threat response state rapidly, or can they kind of calm themselves and logically figure out what that loud noise was? Do you actively avoid situations that make you feel unsafe, or do you even feel safe in this moment? A lot of people tend not to feel safe, and there's adverse childhood events, there's a victim of a crime, there's lots of these that happen. The adverse childhood events, we note that these psychological stressors in the first 7 years of life have such a great response. They're a major reason why there's such variance in HRV later on in life. So these actually do impact HRV right from early ages. Absolutely.
Well, a few things there, Dr. Navas. First of all, when you're talking about major stressful life events, those could be emotional or they could be physical, I presume. They could be
Absolutely.
car
Car
accidents,
accidents, physical
physical
injuries. Yes.
surgeries, as much as they are emotional trauma. I know with the Institute for Functional Medicine, when they do their timeline and matrix, they're always looking for life events all the way back to the type of birth that you had,
Yeah.
and then looking and playing that tape forward to try to
That's
identify those things.
absolutely
And then,
right.
with the childhood events, that also presumes that the individual is even consciously able to recall said events. It gets infinitely more complex when it's just something that it was even when you were too young to even remember. I've had individuals on the podcast who have, through different treatment modalities, uncovered traumas they didn't even remember as adults in life. So it gets tricky to find the things that may be holding us back that we don't even know about that could be adversely affecting HRV. So there's it can go deep, basically, is what I'm saying on this one with the psychological stuff.
I completely agree. And I think this is where psychedelic therapy is really going to help support this movement of identifying stressors that have been
Completely agree.
repressed, that have been pushed into the
Yeah.
body at some point. We'll move into those physical stressors. You're absolutely right. This is where chiropractors thrive. This is where physical practitioners thrive. This is where we're able to assess movement patterns, fitness levels, physical capacity, injury severity, muscle strain and tension, joint mobility, really getting to know what's physically causing stress. My dad came to see me today because his back was killing him and he was unable to breathe because he had back pain. Did some acupuncture, did some work for him. He felt so much better. Leaving his stress level, his breathing pattern changed as he completed that treatment. So physical stress plays a huge role, not one to overlook. Absolutely. Let's go on to the next slide here, which tells us about how active somebody is actually dictates their risk of injury, the percentage risk of injury. The risk of injury is very high in those who are both sedentary and at medium to high activity levels. Okay, so athlete levels are generally you're noticing, right? We all, if you follow sports, you notice, oh yeah, this person got injured, that person's on the injured list, whatever. These are high risk injury prone people. Where we want and where we're generally seeing most people is in that health risk or health low risk or fitness low risk. Somewhere between that 8,000 to 12,000 steps per day, we're going to lower injury risk very significantly. So this is where that 10,000 steps per day number has shown up and been a really big tool for a lot of people. If you aim for that, you generally are going to lower that risk of physical injury. And there was a really great study that was done on the next slide here showing where that exact uh, minimum and optimum dose of movement was when regarded to all-cause mortality and cardiovascular disease. And you'll notice that the numbers are close to that 10,000 mark. The optimum dose for all-cause mortality was 8,763 steps per day. And to cut down incidence of cardiovascular disease, both fatal and non-fatal, was 7,126. If you have your patients aim for that 10,000 number, you're going to help them relay into a state of low physical injury risk. Movement capacity is really great here. And these were all independent of sex, independent of where the wearable was worn. So it doesn't have, like, if they're not wearing an Oura ring, try to get them an Oura ring. But any wearable that helps to objectively track this data is going to be huge. And then if you note step cadence, you'll notice that they're going to get a little bit better. But that 10,000 number is kind of the goal. And if you can get to that number for people that are in a sedentary state, try to get to that 8,000, try to get to that 9,000. You're getting much closer to the lowest risk of issues taking place from a physical standpoint. So let's move on to that next slide where we'll ask a bunch of questions.
One thing here, Dr.
Yeah,
Navas,
please.
this is probably one of the easiest things to measure.
Yes.
Everybody has something these days that gives you even just a rudimentary level of their level of activity. And that's one of the things we can do very quickly at Heads Up is just put 1,000 people on a screen and sort them from highest to lowest in terms of activity. And you can start to look at people who are highly sedentary, in a low 1,000, 2,000 per day, and then also the people who are extremely active in the 15 to 20,000 area. And then you can find that bell curve of people who are in the middle. So easy to assess, and we can make it easy to look at an entire cohort of people just to figure out individuals where they may be too low or maybe too high.
Yeah, absolutely. So most people have some sort of wearable, at least a pedometer at the very least, to tell us how many steps they're taking. And we're notoriously bad at guessing. So, or guesstimating, I guess. So make sure that there is some sort of objective data analysis tool. I
Yeah.
really like the Oura Ring. Sachin got me my first one about 8 years ago, 7 years ago, something like that. And I've loved it ever since. I still have it. And I've replaced my wedding ring with it. Just to that extent, I love it. How many hours per day do you sit? Are you sitting for 3 hours at a time and getting up once for lunch? Or are you getting up and moving every hour? How often are you exercising weekly? What's your breath rate? And breath rate is a big one we'll get to soon. Wearable devices are a huge key here. I think this is great, particularly nocturnal. And then my favorite here is, are you a chest breather or belly breather, mouth breather or nose breather? We'll get into what the optimal here is, but asking these questions helps to identify if somebody's having a physical stressor or physical motion pattern that might be causing them to be in a state of stress. On the biochemical stress side, this is the fourth area, and this is where most functional and holistic practitioners really can put a lot of attention, and we tend to do really well here. We're either looking for too much of a bad thing, things like dysbiotic bacteria, parasites, mold, anti-nutrients, environmental toxins, immune system triggers, drugs, processed carbs, etc., or too much or too little of necessary things. Amino acids and protein, healthy macronutrients, vitamins, minerals, electrolytes, water. We're looking for an imbalance here. Biochemical stress can be either too much of a bad thing or too much or too little of necessary things. Okay. So we know that our bodies are being bombarded with tons and tons of toxins. In fact, I had a great conversation yesterday with Dr. Ailey Cohen, whose new book Detoxify is coming out, I believe, next week or in a couple of weeks. And she told us that 95,000 chemical substances are approved for use in the United States without any need for approval. Like they don't have any rigorous testing. 95,000 chemicals. That doesn't include the pesticides and herbicides that are being utilized on foods. That doesn't include what's going into feed for the animals. It doesn't include what's just being sprayed in chemical cleaning equipment in the house. So there's so many of these toxins that are bombarding our bodies. We're absolutely under constant biochemical bombardment and stress. So these are huge things to assess for. And as we'll find out on the next slide, the most common path where these biochemical stressors enter is through a leaky gut. We all know this. Toxins, pathogens, food particles, drugs, medications, infections generally will come through that leaky gut and trigger that inflammatory reaction where we know that 70% of our immune cells by volume are located in the lining of the gut. So assessing this is going to be a huge part of identifying biochemical sources of stress, and how leaky the gut is going to be completely correlated to vagus nerve dysfunction. And yes, POTS absolutely is directly related to vagus nerve dysfunction. In fact, there's a whole other triad: POTS, uh, POTS, Ehlers-Danlos syndrome, and mast cell activation have been found to be this heavily linked triad altogether. Just an interesting thing to note here.
Yeah, so I guess Dr. Navas, then as you would be able to address gut dysbiosis, you would ideally see corresponding increases in heart rate variability.
Yeah, absolutely. No question about
Interesting.
it. So as you're able to eliminate
Awesome.
these, boost up toxic or detoxification capacity, you're absolutely going to see an increase in HRV over time. I'm going to quickly just note that a big part of the gut here are these L cells, L endocrine cells. And these L cells are the ones that bring in the glucose, lipids, protein intake, and they relay out GLP-1 information. And GLP-1 is relayed up to the brain, satiety-based information. All of the incretin hormones are relayed up through the vagus nerve. So vagus nerve dysfunction is heavily linked to uh, or GLP-1 signaling is linked to vagus nerve as well. And so vagus nerve dysfunction is going to have a strong role to play in noting GLP-1 not being relayed up to the brain. If you go to the next slide, you'll just quickly notice that GLP-1 signaling is actually increased when that same receptor, alpha 7 nicotinic acetylcholine receptor, is activated. So when that receptor gets turned on because we have enough acetylcholine, it actually improves the release of GLP-1 directly, which is really, really important for people to understand. Maybe we don't need to be injecting everybody with the GLP-1 agonist right off the bat. Maybe it's more vagus nerve activation that needs to take place here.
Well, similarly, Dr. Navas, if you are going to use GLP-1, being able to assess baseline HRV before
Mhm.
beginning the protocol, and then while on GLP-1 will be really, really important to identify as well. I know you and I have talked anecdotally about individuals with HRV in the single digits once they start going on to heavy GLP-1 usage. That's an easy thing to monitor
Yeah.
nowadays, and we'll get into that later.
Absolutely. So GLP-1 resistance is what we're now calling it, is when vagus nerve is dysfunctional, we're not getting that signaling up. GLP-1 resistance is almost the same idea as insulin resistance, just in a different area. So an
Interesting.
easy way to understand that. I don't want to spend too much time here. I want to make sure that we can move on. So questions to ask your patients. Are you eating organic, wild raised, free range foods? How often do you sweat? How often do you urinate? Bowel movements, current medication, supplement, dietary choices, cleaning supplies, indoor air quality. Do you live near a freeway? Are there chemical plants nearby? Do you have a gas stove? Do you ventilate your home and bathrooms well? Lyme disease, tick bites, things that as holistic practitioners we tend to be able to, but let's not forego this. This is an important area to understand and is absolutely going to have an effect on that HRV number for sure. So let's
Awesome.
move on to, yeah, I guess identifying vagus nerve dysfunction.
Yeah, so this is where we have some new paradigms that we can start to use data in real time every single day to start to get some actual biofeedback on the potential presence of these stressors that Dr. Navas has identified. And the device we use most commonly at Heads Up, Sachin, I know you also use the ring with all of your individual clients as well as the practitioners you're training. So you've standardized on this device for resilience, recovery, HRV. Dr. Navas, you have as well. Just for the record, at Heads Up, we integrate lots of devices that track these biomarkers. The Oura ring is emerging as one of the more consistent and in general, the gold standard for measuring a lot of this stuff. So we'll focus on the ring here, but just know that it's not the only device that can provide these types of biomarkers. But really, what is it able to do? First of all, it's able to provide heart rate variability every single day nocturnally, which means the individual doesn't have to measure it in the morning. Before we had these devices, you may recall, we had to put a heart rate monitor on, pair it to an HRV app on our phone, sit quietly for 3 minutes in the morning, and get a reading. And by nature, compliance is going to be lower relative to data that can just be collected passively, which means the individual client doesn't have to do anything. They just have to remember to put the ring on when they go to bed. Second is we're getting a much, much longer sample period. Back before we had these devices, you'd take a 3 to 5 minute HRV reading in the morning or multiple times per day. Now we're measuring actually every single heartbeat through the entire sleep cycle. So instead of 3 to 5 minutes of data, we're getting anywhere from 6 to 8 hours of continuous passive data. We're also getting respiratory rate. Dr. Navas is going to talk about how that can also be an indicator of vagal nerve dysfunction. It gives us very solid indicators of sleep and the parameters associated with sleep, or we can identify dysfunction in sleeping patterns, resting heart rate, and more. One of the challenges that Sachin first had to work around was how do I even get sizing kits and rings to people and get them instrumented and get that data into Heads Up so that I can even do any kind of monitoring here. That actually was a very, very large hurdle, and it's still a hurdle for any practice that wants to do this. You have to get each person instrumented and then have a way to get that data flowing back to you so that you can actually review it. We have a program where we can drop ship sizing kits and rings directly to clients, which just helps lower the barriers essentially to getting access to this data. So as Dr. Navas mentioned, HRV, looking at the variation between the beat to beat intervals and collecting that data nocturnally, just basically means while we're sleeping, as a way to get an indicator of the balance between sympathetic and parasympathetic. It varies from person to person. It varies by age. It varies seasonally. So what's really important is, first of all, to just get a baseline on each individual. And you're going to see large variance in the baseline from one person to the next. But what's really important is just to get that baseline and then start to work with each individual from that baseline, rather than being able to say, for example, that you can compare the baseline from one person to the next. As Dr. Navas pointed out, there's a lot of reasons why the baseline from one person to the next is going to vary. But what's important is just knowing where each person has started and then building that person up from their individual baseline. So if you are familiar with the Oura ring, this is 2 nights of data from the same individual. And what you're seeing on the left here is a heart rate variability of around 23 milliseconds, which is significantly below this person's baseline. The max was 50. And you'll even see the variation throughout the sleep cycle. There's a very little amount of deviation here. The band between the upper and the lower is quite low. And that very same individual on a night where they were able to focus on rest and digest, and they were able to focus on getting to bed at the right time, doing some breath work before bed, feeling in a safe environment, not being on the road, not being out late, whatever it is, you can see on the same individual, the score is almost double, the max is almost double, and you just see this large variation. Even at the beginning of the sleep cycle, you'll see this very, very high level of variability. They went into the night well recovered. So this is the type of feedback we can start to get on individuals every single day. Sachin, I'd love it if you chime in here. This is one of the first things you keyed in on, which is I can use this as kind of like my check engine light for individuals and figure out, okay, I can look at where they are from night to night and just figure out how they're doing. So anything you want to add here, Sachin?
Yeah, thank you. First of all, this has been profoundly great information. So thank you, Navas, and some great questions that are coming in as well. One of the things that I'll say about this is that not only can the clinician monitor, but more importantly, the client can monitor.
Yes.
So that's what I like about this. Our philosophy is the doctor of the future is the patient, and they can actually do experiments to see what works for them and what doesn't, right? So we can see what one glass of wine does to them, what a late night meal does to them, what a stressful argument, or checking emails too late at night does to them. So they're able to get some key insights. And of course, if you as a clinician recognize a pattern, then you can jump in there. What's really cool about HRV is that prior to symptomology, people will know they're coming down with something, and so sometimes they say, hey, when you have the first sign of a cold or a virus, do this. But what if you could get a 2 to 3 day lead time before the symptoms show up? You can knock things out before they become symptomatic, even because you kind of know, hey, here's what my normal baseline is, and here's where it's trajecting towards. So I like the self-sufficiency that the Oura Ring provides for the client, and then the in-depth insight that it can provide the clinician, as well as we are able to monitor using Heads Up. That's the beauty of Heads Up, is that the client and the clinician are able to view the results on a daily basis in real time.
Yeah, teaching individuals how to self-calibrate to their HRV is probably one of the most impactful things we can do. I'd say the second most is teaching people how to self-calibrate their blood glucose to the CGM. So we teach people how to read this data. There's a great example here. This is a screen from the Heads Up software. This is from one of our clinics, and Health works with autoimmune patients, and every patient coming into the And Health program gets an Oura Ring. And so what you see on the graph here is this is a real case study from one individual, and his heart rate variability here, you can see initially the baseline here is 27. Already that's a clue that if this is the baseline, this is already low. So that would be an indicator that, to Dr. Navas's point, one of the 4 stressors is present. And then what happens here is you can see this number starting to get progressively worse to where it bottoms out around 17. Now, inside Heads Up, we can also overlay that with other data. And what you see was we also had their training data. And this individual had gone on a series of 30-mile bike rides, which for someone without an autoimmune condition would probably be a stressor that their body can handle. But in this case, it was too much for the individual. And here they started experiencing joint pain and swelling. Here they had to start prednisone. So this individual effectively overtrained themselves into this situation. And what And Health is able to do is, obviously they can intervene when they see HRV going down, and we can flag that for them. But to Sachin's point, what they'd rather do is teach the individual how to read their own HRV and teach the individual to see, if you start going down for multiple days in a row and you're now getting into the below 20 area, you have to completely shift gears and focus on rest and digest, or you put yourself at risk. Now, this isn't a case of autoimmune, but actually it applies just to everybody in general. Just for people going about day-to-day life, learning how to read these numbers and know, when is my body resilient and ready to be pushed, and when do I need to slow down? That to me is the takeaway, not just for autoimmune, for everybody. That's probably the most important thing any of us can do, even healthy people who want to perform at their best every single day, is just learning how to read this number and self-calibrate. So I think this is a good illustrative example, but we can extrapolate this to everybody in day-to-day life. If I look at one number every single day as soon as I wake up, this is it. Obviously, there's others I like to check, but I live and die on this one number as a business owner, entrepreneur, whatever your pursuit in life is. HRV is probably the most powerful. Inside heads up, we can also automatically alert clinicians. So obviously, you've got 10, 50, 100, 1,000 individuals with data feeding in the system. How the heck do you know which ones have gone down for 3 days in a row and are now outside their baseline? It's impossible to come in and do this one by one. So what the system can do is we can program into the system to automatically flag individuals who have gone out of range. So in the end health example, we've configured the software to say, if an individual's baseline has gone down for 3 days in a row, we can put any number of days, and they are now more than 20% below baseline, alert the coach or the clinician so we can review the data, decide if we want to follow up. So you can basically just log in the morning and look at the short list of people who have gone out of range. And that makes it a lot faster and a lot easier to make a clinical intervention if that's necessary. Also, being able to look at sleep, looking at resting heart rate is also a good indicator of how physically rested they are, of cardiorespiratory fitness, the quality of the sleep cycle, their circadian rhythm. Do they have a natural light-dark cycle? This can also be a really helpful indicator of when are they going to bed, when are they getting up? Are they getting even the minimum amount of sleep required to have any resiliency at all physically? So there's a lot of clues of resiliency that come from the sleep data. Sleep apnea, Dr. Navas, I'll turn this one over to you to speak to.
Yeah, this was a really interesting one. There's a bunch of research out there. I'll talk about a couple of things. CPAP therapy, those who have sleep apnea, obstructive sleep apnea specifically, have lower baseline HRV across the board. That's an absolute. So obstructive sleep apnea during the night shows up with lower HRV during the day. So that's an interesting one to note. One of the features that I really love about the Oura Ring is the unguided session where you're able to pull your HRV while you're awake in a real-time process. Just 3 minutes and you'll be able to get that info. So for somebody who's interested in knowing what their HRV is and if they're doing a breathing practice or something that they want to note, that unguided session is a great tool. When it comes to sleep apnea and CPAP therapy specifically, CPAPs literally stand for continuous passive airway pressure. It's passive, meaning that it's passively activating or opening the airway, enabling patency to be there, meaning that the vagus nerve signals don't have to come in. So while somebody's using a CPAP unit, their HRV will generally be lower. You'll notice a dip of between 10 and 30 points depending on their baseline HRV pre or post. So just note that nocturnal HRV in CPAP users is generally lower. So be aware of that. Sometimes they'll need it, but there's so many other tools that you can use to help support that. Nasal breathing, sleep, strengthening your diaphragm, breath work, something that Sachin will get into a little bit. Incentive spirometers are great tools. Trigger point release in the diaphragm. This is something I learned from Sachin, but we tend to hold trauma in diaphragmatic points, trigger points. And so diaphragmatic release can be a great tool you utilize to help release some of that psychological stress or those traumatic incidents. Tools like crocodile pose, seeing an airway dentist, these people have been just phenomenal. They really understand how the airway should be working and how to optimize. More sunshine absolutely does decrease sleep apnea as well. So these are great tools. And then in regards to how to figure out what's going on there, there's great apps like SnoreLab that are out there for those who aren't using a wearable or just want to know how their breathing is through the night. Breathing cadence, getting into a state of coherence breathing using tools like HeartMath in a therapeutic manner can be very beneficial. Sachin and I are both huge fans of the BOLT test, the body oxygen level test, which is a great test for anybody who wants to know what their cardio or their CO2 tolerance level is and how long they're able to do this. This is a great way to just kind of get an idea of your VO2 max type of idea or cardio fitness. So I know I breezed through those. Satch, any other points on those?
Yeah, absolutely. So breath is a window into an individual's nervous system. So if you have a client, whether it's on Zoom or whether it's in person, don't rely on what they're telling you about their stress levels. Pay attention to the way they breathe. So even early childhood traumas can be observed in the way somebody breathes as their default breathing signature. As Navas mentioned, we store our trauma in our diaphragm and we store our grief in our lungs. So many people are carrying around a lot of trauma, especially these last few years, and they're carrying around a lot of grief. Many people have lost loved ones. Many people have been traumatized. So you have to be looking for people's breathing signatures. Now, some of you might know that, or maybe if you've experienced this or even been on the receiving or giving end of this, where you are told or tell someone to stop crying. Well, the only way to stop crying is to stop breathing. And so what happens is our diaphragm has to hold real still for us to stop crying. And and as a result of that, we develop these trigger points, and these trigger points act like a patina, which essentially scar or limit the range of motion of the diaphragm, which creates a short, shallow breathing pattern. And in that short, shallow breathing pattern is what creates a perpetual fight or flight state for people. And so when somebody's adrenals are exhausted, or even if they're doing all the things you're telling them to do and they just can't seem to get out of fight or flight, pay attention to the way they're breathing. Now, mouth taping has taken on a huge bit of people's attention. And when we encourage people to mouth tape, we just use something really simple. We use 3M micropore tape. You can get a dozen rolls for $10 on Amazon. It'll last you 3 years. And you're just placing the tape vertically over somebody's mouth. So you don't have to hermetically seal the mouth. When the jaw is relaxed and closed, a couple things will happen. One, people will stop grinding their teeth. Two, their tongue will be positioned in the correct place, which also activates the parasympathetic tone and relaxes us. This is why children suck their thumb or use a pacifier. There's a magic button at the roof of your mouth that gets pressed. And nasal breathing increases nitric oxide, which relaxes our blood vessels. The heart has to work so much less. The diaphragm is known as the second heart. So when our diaphragm is properly strengthened using breath work or something as simple as crocodile pose, laying on your stomach for 2 to 3 minutes and breathing into your belly, that's going to assist the heart in mechanically moving the blood. The biggest lymph nodes in our body are underneath our diaphragm. The incentive spirometer is really interesting. They give this to people who have pneumonia in the hospital, but you can buy one on Amazon for like $20, $25. The greatest predictor of lifespan is actually lung capacity. So if your clients are using an incentive spirometer, they can literally increase their lifespan by improving their lung capacity. And the incentive spirometer is a great tool for them to do that. If you want to release the trigger points, have somebody lay on their abdomen and just gently breathe in and out. And then you're just going to hook their fingers underneath the rib cage and they'll find those trigger points. We've had people start crying because they're releasing this trauma that they've been holding on to. And one thing to keep in mind is the diaphragm is the conduit of the forces that go through the myofascial system. So think about the myofascial system as this web-like matrix there. So what happens with when we breathe correctly, it sends information to our nervous system that we are safe as well. So people who are short, shallow breathing, they're sending a danger signal to their nervous system. So these are some key things, paying attention to the client's breathing signature, releasing their diaphragm, enhancing and improving lung capacity. These are going to be ways to improve vagal tone, but also to improve the state of one's nervous system. And something that can be quite easily assessed and done. Breath work, like Wim Hof type breath work, elemental breath work, which is what I do, can be also very powerful in creating, really truly transformational experiences for people. So a lot of our issues are in our tissues, as we all know. And so using experiential breath work can also help people release trauma that they're holding on to. So, therapeutically, breath work has been one of the most powerful tools and windows into the nervous system that I've found. And just keeping in mind where we store our grief, where we store our trauma is an important way for us to assess how we can best support the client. A couple things to also keep in mind, I think it may be coming up in a slide here or two, is teaching your clients how to breathe correctly. So something called coherence breathing is where you breathe in for a count of 6 and out for a count of 6. When you do this, what ends up happening is you go into a more coherent state where your heart and your brain are better connected, and you'll be able to verify this with heart math as well, because your HRV will increase. So cool things start happening. And then with apnea, here's an interesting thing I learned from Dr. Jack Cruz. There's central apnea and there's obviously peripheral apnea. So it could be some sort of physical obstruction. But one of the things that I'm learning is that when your melanin sheets are dehydrated because of a lack of sunlight, the body actually protects itself and goes into an apneic state. So SnoreLab is a great way for people, especially people who are single and live on their own. They may not know, their partner may not tell them they snore. Snoring is a number 3 cause of divorce. You can look it up, the crazy fact. But if your clients snore, they'll never be metabolically healthy. They'll wake up more tired. Their blood sugar will be elevated in the morning. And even though they're eating perfectly, it's because of the way they're breathing. When we breathe with our mouth open, or when we have apneic events, we go into a micro fight or flight type of state. And when we're in that fight or flight state, then we're increasing blood sugar, we're increasing cortisol, we're becoming more insulin resistant. So it's amazing what can happen when people start breathing better while they're sleeping. The way somebody breathes while they're sleeping is probably one of the most overlooked healing opportunities in all of holistic healthcare. Very few people are talking about this, and you might be the only one that picks this up with your client. So just make sure you're doing that. And the Bolt test is a great way to, the Bolt test is actually probably the most accurate and easiest way to measure mitochondrial function. So basically you can look it up. It's breathing in, and then with a relaxed exhale, you plug your nose and hold your breath until your first urge to breathe. And Patrick McEwen talks about this in his book, The Oxygen Advantage. This is a great way to very non-invasively test your client's mitochondrial function, and they can do it every week and send you the results. So I have my clients send me their Bolt score every Friday. And so they're able to see, hey, I started off at 20 and now I'm at 30, now I'm at 40. We want to see them above 40. Even elite athletes will have a Bolt score in their low 20s or sometimes even in the teens. And as you work on improving their function, you can, in a non-invasive way, test them to show them that there's an improvement happening as well. So those are some of the things I want to add. I know we want to save some time for Q&A, and yeah, thank you for.
Are you guys seeing the slides here, Sachin? I had an internet connection blip. Are we back on track here?
Yeah, I think we're back on track.
All right. So let's see. We've got about maybe 10 more minutes I want to go for. Dr. Navas, you also wanted to talk a little bit about respiratory rate, which is another easy one that we can pull from just off-the-shelf wearables these days. Much like HRV, we can get some good indicators of how many times per minute someone is breathing. So what are you looking for, Dr. Navas, with respiratory rate?
Yeah, we're definitely looking for blips. So you'll see this is a screenshot of a week that I got sick and my breath rate went up. I was dealing with a respiratory infection and was out of town, and it was chaos. And you can see there was a week prior and my baseline is around that 15.3. I've actually worked that down. I'm more into the 14s now, which is great. But this is a great way to understand what your nocturnal breathing rate is. Obviously, if we can do full quality breathing assessment through the night, that would be the best. So SnoreLab is a great way to assess that piece. But respiratory rate is overlooked, and it's something that should be understood. Respiratory fitness, and as Sachin mentioned, the Bolt score being a sign of metabolic flexibility and mitochondrial function, really is a very low hanging fruit that a lot of people like. Bolt test isn't a test you can do on a daily basis. You don't need to. It's a weekly test, but it's a great way to assess where you currently stand, and what your respiration is doing is going to then dictate a lot of what's happening in your body. And if you go to the next slide there, David, you'll notice there are averages, there's normals. We see that 12 to 20 marker, but optimal is generally lower. We want to be efficient in our breathing, and efficiency is the key here. If we're efficiently breathing, then mitochondrial respiration is efficient. And so that's how we're able to play that together. So for males, anywhere between that 10 to 14 breaths per minute nocturnally, when they're not consciously in a breathing pattern, is where we want to be. And for females, slightly higher, 11 to 16 breaths per minute. Just generally smaller lungs, more breaths are required. When we're in a resonant respiratory rate, this is when we're actively doing like HRV training through breath work. You want to be somewhere between that 4.5 to 6.5 breaths per minute in order to see a change in your HRV. So you can do HRV training through breath training, and that's how breathing is so heavily linked. And we'll get into the breathing pattern and the treatment protocols, which we have a little bit of time to get to, I think.
Yeah, one thing
Yeah,
I
just a
might add
standard
here.
meditation session, you're going to get down to 4 to 6 breaths per minute just by closing your eyes and just breathing in and out. You'll drop from 10 to 14 to 4 to 6. Another reason why breathwork meditation are so effective, presumably. Sachin, you had a comment?
Yeah, just something to keep in mind here is from a longevity standpoint, there's a lot of people talking longevity these days. The fastest way to slow down the aging process is to slow down your breath. And if you study animals in nature, those that breathe faster live shorter, and those that breathe slower, like a turtle takes 3 breaths a minute, ages to about 150 to 200 years. A dog takes 35 breaths a minute, ages 7 times faster. So the respiratory rate actually determines lifespan. And so in Eastern medicine and philosophy, you're born with a certain number of breaths. In Western medicine, you're born with a certain number of heartbeats, but you can't control your heartbeats without first controlling your breath. So it's the
Agreed.
direct access point to longevity. And so, again, not many people are talking about this. People are piling on supplements and stuff like that. But ultimately, the slower you breathe, you actually deliver more oxygen to the tissue. It's called the Bohr effect. So you're actually able to get more oxygen per breath. With each breath we take, there's actually 5 additional breaths. You only absorb about 20% of the oxygen with each breath you take. So slowing down will increase oxygen delivery. And the urge to breathe comes from a low CO2 tolerance. So you can actually build up CO2 tolerance in order to be able to further slow down your breathing. So if breathing slow gives you anxiety, it's because you're not tolerant to CO2 and not because you need more oxygen.
Yeah, the yogis, Sachin, were the OG longevity biohackers. They knew that just slowing the breath rate through simple mindful breath actually is the key to slowing down heart rate, increasing HRV, increasing longevity. And as you mentioned, for all of the longevity hacks we have on the market nowadays, from gene therapy to peptides, you can go back to the simplest of them all. And you're going to talk about this in a minute, which is breath. But just quickly here, tracking respiratory rate for individuals through Heads Up. Again, we can start to flag deviations from baseline for individuals. We can start to look at an individual relative to a cohort. So with Heads Up, we'll pull in the HRV data, we'll pull in the sleep data, we'll pull in the respiratory data. We'll give you the tools to use this in clinical practice. Dr. Navas mentioned some of the functional testing that would be able to look for toxins, mold, parasites, environmental toxins, heavy metals. This is the stool test on here. This is an organic acid test. I mean, we could do entire webinars just on these 2 panels alone. But Sachin, Navas, anything quickly you just want to mention on some of the diagnostic testing here?
This is where we're going to get that biochemical stress piece really relayed in, and I love the root cause analysis, but they're pretty straightforward for most people that are in the functional holistic world. You kind of know what you're doing here.
Yeah, and then again, these functional diagnostics, it becomes very tricky to work with this data in PDF, especially when you're trying to compare results from test to test to look for improvements. You can just upload these PDFs into Heads Up. We'll strip out all the data. We'll store it, organize it, make it very easy to run analytics on it, look for changes from test to test. So as much as we do the work on integrating the Oura and bringing in what we call the day-to-day biomarkers, we also do a lot of work to get this data out of clunky formats and make it structured and visual and be able to run analysis on it. And then obviously there's just standard assessments, perceived stress scale, promise scores, other types of subjective information. These are all things we can use to assess the 4 types of stress that Dr. Navas laid out earlier. let's see, we've got about 10 minutes left. So Sachin, Navas, I'm going to turn it over to you guys to walk through the last section here, which is okay. We understand the 4 types of stress. We've got biomarkers we can use to help us triangulate. And now what can we do about it in terms of treatment protocols? So over to you guys. If you want to roll for about 5 to 7 minutes, that'll give us enough time for Q&A and prizes, and we can stay on time here.
I'll be as quick as I can to run through these. I start with foundational exercises where the breath, meditation, and circadian health come in. Advanced exercises for those that want to really boost up their HRV. Therapeutic tools I find are really beneficial for those that have difficulty shifting from sympathetic to parasympathetic. We'll talk about true vega and vagus nerve stimulation quickly. Obviously, lifestyle optimizations, and I use fasting as well as a great tool. Let's move on to just breathing, because I think breathing is something we've talked a lot about, but it's really overlooked in healthcare overall. Rate, efficacy, and efficiency. We've kind of talked a lot about that, but I want to talk about how it affects HRV, which is on the next slide. Remember, we brought up this idea that the heart rate getting faster, the heartbeats becoming closer together, that's like the accelerator being pushed. We're pushed into a sympathetic state. Well, inhalation does exactly that. Inhalation is like pushing the accelerator. Our heartbeats get closer together. As we breathe in, heartbeats get closer together, and that creates shorter interbeat intervals, shorter RR intervals. As we exhale, we actually lengthen out those interbeat intervals, and we get to the longer ones at the end of that exhale. So inhalation is like the accelerator, sympathetic activation. Exhalation is like the brakes, parasympathetic activation. When we have inefficient breathing patterns, you'll notice that we are stuck more in that sympathetic state, and this is how HRV is actually driven. It's called respiratory sinus arrhythmia. And this is how breathing affects your HRV. This is kind of that take-home point of just how important the breath is. We can then create HRV changes when we learn to breathe very effectively. So the 3 things you want your breath to be: nasal, breathing through your nose; diaphragmatic, focused on diaphragm breathing, not accessory muscle breathing. How many of your patients have tight traps, tight upper back muscles? They're often using those muscles as the primary driver of breath, and they're not utilizing their diaphragm effectively. And the last piece is longer exhales. If we're spending more time on the exhale, we're spending more time in that parasympathetic state, and then we can shift easily. It's as simple as you hear a loud noise, you tend to take a quick breath in, immediately going into a more sympathetic state. But as we end that stressor and the stressor goes away, we immediately take a bit of a sigh and go, and that sigh of relief, is us shifting into that parasympathetic state. And it's an exhale. It's always an exhale pushing us parasympathetic. So learning to utilize that pattern, training yourself to breathe more effectively, that's a great way to understand how the breath affects HRV overall.
So, Dr. Navas, I know in a lot of the breathwork classes I've done, they've often emphasized to focus on a longer exhale and a shorter inhale. So a breathing practice might look like, for example, 5 minutes, let's pick a number, of a 4-second inhale and a 6-second exhale. Would that be a type of practice that an individual could start small, 3-4 minutes a day, and just build up from there, where you're actually doing a counted inhale and a counted exhale?
Yeah, absolutely. So starting point, box breathing is a great place. 4 seconds in, 4-second hold, 4 seconds out, 4-second hold. Then moving into the 4-6 pattern, 4 in, 6 out. And then my favorite for HRV training is 4-7-8. 4 seconds in, 7 hold, 8 exhale. 4-7-8
okay.
pattern.
I like that one. I haven't tried that one before. I'll put that on the docket.
Yeah, and that's the one that Navy SEALs use to fall asleep in about 2 minutes.
Wow, 4-7-8. Okay, I love it. Hadn't heard of that one before. All right, another good pearl there, Dr. Navas. Okay, mouth taping, nasal dilators.
Yeah, we've talked about both of these. Great tools for supporting the breathing pattern at night. And then we can get into true vega and
any brands you recommend here on the nasal dilators? I haven't used these before. I have messed with mouth taping. It's very effective for me. But any products you recommend here specifically, Navas?
Some people don't mind the Breathe Right nasal strips. Those are okay. The tape is not the best, and they're not the strongest. But Sach, I remember you mentioned one that you really like. Why don't you
Yep.
share?
So this one is called Intake, and it's based on magnets. So
Yeah.
you apply a couple of magnets on your nostrils, and it really opens things up. So that could be a great nasal dialer. There's also one called Mute, which is a device that goes into your nose, and that um, keeps the nostrils dilated. So that could be beneficial for
Awesome.
people as well.
Thanks, Sachin.
Now, vagus nerve stimulation, I think, is something that people are really interested in, and for good reason. The research has come out, and we see that the use of vagus nerve stimulation in the right circumstances, you're going to have some pretty phenomenal changes. There's a really unique way to understand how it works, and I'll go through the next bunch of slides really quickly to let everybody know. So remember when we found the vagus nerve beside the carotid artery at the beginning, this was a study, fMRI study, showing that when you stimulate the vagus nerve directly in that area, not over the SCM, you get activation of the nucleus of the solitary tract, dorsal motor nucleus of vagus. You'll also get vestibular nuclei turned on, and the medial longitudinal fasciculus in the brainstem get turned on. And interestingly, you also inhibit the spinal trigeminal nucleus where pain is often passed through. So you're able to slow any trigeminal nerve pain as well. But really interestingly, the NTS and the dorsal motor nucleus of vagus, those two are activated heavily. We can go on to the next slide. What then occurs is a 15-minute biphasic response. Through fMRI, they've shown activation in certain areas and inhibition in other areas, but the key one is they're able to activate and then inhibit the thalamus. And the thalamus is the key to turning on sleep and mood and emotion and memory activation, thus relaying this information out. There was a great research study that just came out in Nature showing that the thalamus is where the relay of all the information goes through for cognitive and just full on overall experience of coordination of function. So thalamus is key. So if you can have an effect on the thalamus, you're going to have that very positive effect. And the next image actually shows exactly that. When the vagus nerve gets stimulated through these afferent pathways through transcutaneous vagus nerve stimulation, non-invasive form, you're able to activate those specific areas, sleep, emotion, arousal, plasticity, and memory in the thalamus specifically. So really, really powerful stuff here, being able to turn on the vagus nerve and have this relay of information positively take place above. We'll quickly breeze through the research studies that are here showing that VNS reduces nausea rescue medication in gastroparesis and related disorders. And they had several relatively unexpected positive benefits, including reductions in pain, constipation, depression, and even autonomic symptoms. On the next one, this was an implanted device that they found after the implantation of the device. 32 patients that had received an implanted device, they did a retrospective study and they showed that 17 of the 27 who had data had lost weight after this. So they had become more metabolically capable of handling things. And some of them significantly lost body weight, which was a very, very old study. That was from like the 90s. So we're not able to pull great data from it, but it's just a really unique retrospective study to look at that. The next one, we're able to show that it alters microglial morphology. It actually changes the shape of the microglial cells from a fight state to a fixed state, from an M1 polarized macrophage or microglial cell into an M2 state. And that's through upregulating that same alpha 7 nicotinic acetylcholine receptor. So they actually showed morphological changes in this. And the next one shows a couple of research studies where IL-6 and other inflammatory cytokines were reduced when vagus nerve stimulation was utilized. So we're able to lower inflammatory reactivity, down-regulate the immune system into a more recover-based maintenance state rather than an inflammatory state overall. So we can move on to how Heads Up can support that.
Yeah, so we've covered a lot of this already, but being able to pull this data in real time, being able to build dashboards that can track the BOLT score, the HRV, the blood sugar, the respiratory rate, whatever you want to monitor on each individual can go on a single screen, even some of the interventions you want them to focus on. We are actually starting to see some really interesting data on hyperbaric oxygen therapy and benefits. on heart rate variability. So this is an intervention that's starting to become more accessible. These chambers used to be prohibitively expensive and only really available for very, very specific sets of medical conditions, but they're now starting to become available in just general wellness and biohacking clinics, and they can have positive impacts on lots of the areas that Navas talked about in terms of physical recovery, wound healing, vagal tone, just oxygenation in general. We're seeing interesting data on HRV. This is one individual who had a 28% increase in his Oura HRV after 100 hours of therapy, which was about 50 sessions. I think that's it for the content. That was awesome, Navas and Sachin. So just a massive, massive thank you. Any parting thoughts here as we adjourn?
Well, I want to say thank you to the Heads Up Health team. Not just Navas and David for the continuous work that you guys put into making this platform possible. One thing everyone should know: in 2020, data surpassed the value of oil. And so, if you're not collecting data from your clients, whatever you're claiming isn't happening. And so, if you really want to increase the value of your practice, incorporating data is one of the ways to do that. It is an objective validator of your outcomes and results, and an important way to set yourself apart. One of the things I like about collecting data is it's a very short feedback loop. So people can see very quickly that they're moving in the right direction, which gets you more compliance and buy-in. And they can also share that with their friends and family members, so they can refer people faster to you as well. They don't have to wait until their second stool result comes in or blood work comes in 6 months from now to validate what you're doing. So you'll get better buy-in, you'll get more referrals, you'll increase the value of what you're doing. You'll be able to go to agencies and organizations and say, hey, here's the results that we're getting with our clients, further validating what you're doing. And so thank you, Heads Up Health, for doing this and making this available to us practitioners in a very accessible way. It's a wonderful platform. And I'm so glad that so many of you attended today, because this is truly life-changing information, Navas, that you shared today. Super valuable. And thank you for the team behind the scenes, Aaron and Chuck and Dr. Moxley for facilitating and answering the questions that were coming in. So all around awesome work, team.
Did we
That
want
was awesome.
to answer a few questions?
Thank you, guys.
That were left over?
Anyone you was going to take live? Sachin, we got one for you. If you used one data point, what would it be? That's from Shauna.
I think we answered it during the session. It would be HRV. Yeah, HRV is like a really powerful proxy for just overall health and resilience. So that would be a good marker, non-invasive marker for us to track and monitor. And then the second one, somewhat non-invasive, but you have to pierce the skin, is blood sugar. That's the dance between cortisol and insulin. So
yeah, and the CGM is now demystifying that, where we can, you used to have to wait for a hemoglobin A1C number to get good indicators. And again, that's now tracked every single day. And just like HRV, it's not that hard to optimize, and it's not that hard to teach people how to self-optimize. And then with a clinician on the other end to help them with the next level of interpretation and the expertise on what to modify and what to try. Just fixing HRV and blood sugar alone, I say this all the time, you can get most people 90% of the way there.
Yeah, and I see here, Stro, I hope I'm pronouncing that correctly. Great to see you, my friend. He's mentioning VO2 max, and with the Oura ring, you can actually measure. It's obviously not as accurate, but pretty close proximity to measuring HRV just by going for a walk. So that's one thing to keep in mind, is the Oura ring. It's actually doing a lot. I think the next iteration, hopefully, is that it has a light sensor, so it can tell how much time you're spending outside. That would be the nice. That would be a nice Gen 5 upgrade that they could do, because that's the one marker that I feel, if we could have more insights on that, would be extremely valuable to determine, overall kind of quality of life for people, is how much time they spend outdoors.
Outdoors under full spectrum light.
Mm-hmm.
Stephanie's saying Oura ring being used more and more within the cancer community. Yeah, I can only imagine the effects on HRV. First of all, just from conventional chemotherapy protocols has got to be just extremely challenging. But then also from an integrative perspective, what we can do to help complement the body while we're going through these treatment protocols, and then also of a good indicator of the resilience of the system and the individual recovering. There may even be correlations about, well, we know that a lot of the psychological and environmental stressors, those are actually trigger points for cancer in the first place. So there may even be some predictive diagnostic abilities in there. So it's really interesting to hear that you're seeing it more in the cancer community. All right, everybody, we're going to wrap it up here. Again, thank you, Navas. That was just phenomenal. Really, really phenomenal. And thank you, Sachin. It's been a great pleasure working with both of you guys. This was an awesome webinar. So we'll get everything cleaned up and get a recording out there. And thank you, everybody, for taking time out of your day to join us. Signing off, everyone. Thanks.
So Heads Up is a data platform that connects an individual patient and a practitioner provider, and it creates a common space where healthcare can be accurately tracked, measured, and optimized. So how do we do that? Let's take a walk through the system. So the first step is getting users in the system through the Manage Users function. You can import CSV files, and if you have an existing practice management or electronic health record system, we can actually integrate into your existing systems and create what's called a single sign-on connection. And the first thing we do for each client is we give them the concept of their own personal health dashboard. And the dashboard is going to contain the metrics that you need them to pay attention to as part of the journey. So the first thing we do is we allow the ability to capture data from clients remotely. And the way we do this is we connect to the latest cutting-edge sensors and wearables on the market. And what these are doing is they're passively collecting data in real time, sending it into the system so that we can use that for day-to-day, what I like to call micro calibrations. These are the lifestyle changes we can make. So you can see here, we integrate all of the top FDA-approved medical devices, and we will customize these dashboards based on your exact programs and protocols. So the next section we want to review is lab results, and Heads Up is able to take in diagnostic lab data from any source. You can see that we pull in traditional blood work here. We can also pull in data from DEXA scans, in-body scans, urine and microbiome, heavy metals, stool, and we can start to see and track these lab results over time. The next thing we want to look at is what we call progress reports. And progress reports, that's what's going to let us look at an individual's health over the last month, over the last quarter. You can see here, it looks like this day we hit 208. So that's a day I'm going to want to double click into. And I may want to ask the individual, was there a specific meal that you ate on this day? And if I can say to a person, instead of eating a cup of rice, why don't you try a quarter cup of rice? And we start to see how we can make these small changes now that are going to have long-term benefit on preserving the health of the system. You can see we're capturing a lot of different information, and when we work with a clinic or an organization, we'll build each portal to help you capture exactly what you need. So we custom build each instance of Heads Up exactly to your program and exactly to your protocol. So that's what each individual will experience. Now what we want to do is start to say, okay, I've got this data now coming in from dozens, hundreds, thousands of clients. How do I start to analyze this information at scale? First is we want the ability to identify outliers. So the first thing we want to do is have the ability to come in here and set notifications to only flag the things that we're interested in. So that's where we can start to take all this data in and really just look for very specific signals that you care about, that you want to engage in. This is going to save you a lot of time, and it's going to help you identify only the instances where you need to engage. So that's alerts and reminders. When we work with your organization, we'll build out all the intake forms and assessments that you need. They can be quickly assigned, and we'll show you how this data comes in. Each of the answers to these questions is also stored in the database. Templates allow us to create content that we want to create once and share many. This is the HIPAA-compliant messaging, as I mentioned, so we can do secure messaging to each client bidirectionally all encrypted, all stored in the database, all very secure, accessible to clients on the go through the mobile app or through the web browser. So here is where we can start to build any kind of report on top of the data that you want of my entire cohort of people. Very simple queries we can do on top of the data to answer questions quickly. So we launched the concierge service, and this is the simplest way for us to help you structure otherwise fragmented data. All you do is click on concierge, browse onto your computer hard drive. Let's say this is blood work for an individual client. All we need to know is who does the PDF file belong to, and you can upload multiple. We will take it from PDF, structure the data, and put it back on the trend line with all of the other tests that represent the same value. That's how we start to holistically bring fragmented data together. We just need to know, what is it that you're trying to measure? How do you want to define success for your program? And then we'll build an instance of Heads Up exactly to your business and get you the exact outcomes you need. That's Heads Up. That's how we make health measurable. Thank you.